Choose country. Discover the rural practice pathway to a health career in WA.
It was probably a shared journey for us, I think. I mean, Bethany always had a vision, I think, coming from the country of going back and providing some of the services that perhaps she felt people were missing out on. So we had a lot of exposure to the country, and I guess I always imagined it was something I'd like to go back and do.
We both did our electives and went away for 3 or 4 months separate, but chose not to do rural clinical school because we already had the plan to move to the country, and I think that's a great opportunity for people to get a taste of country life who don't know what it would be like.
One of the hard things about the planning was trying to really synchronise that so that we'd finish our procedural work at the same moment we'd be able to go somewhere and actually use it.
Basically your procedural skills, they're big hours and they're long. You know, starting hospital at 7:30 and getting home at 6 o'clock and later, often, and shift work. So we did that first, which might seem slightly backwards if you're thinking about planning a training. You go into GP and then you tack on your procedurals, but we planned it the other way around. So I did trained at King Edward's Memorial Hospital, and we both did our time at Princess Margaret Hospital, and we did most of our GP training then in the country, and we could chop and change, go part-time, stop for 6 months, go travel, come back, because GP is such a flexible training position.
We both work a little bit less than full-time in terms of office hours. It's probably made up for by the on-call. But we've managed to, I guess, control our work, and within general practice you have a lot of flexibility to do that.
I've just had my 4th baby. I've worked the whole way through. I've taken time off to have kids, but I've just sort of wound down my hours, wound it back, kept the obstetrics going, and then wound it up kind of after 2 months or so, rather than being off completely for 6 months and then coming back on. I thought that was more gentle on my family.
The first thing I think is to not be afraid of actually taking the plunge and going rural as though that's going to threaten your career path. You know, there's a real worry that if you get off that track, it might be hard to get back on. But I think the reality is the breadth of skills and life experience that you get in the country only enriches your CV and your ability to be able to go into whatever it is that you'd like to do later. The family life that we're able to do, to just duck down and have a fish after work, you know, with the kids off the jetty, or to head down to the beach in the morning, or whatever it is, these are really precious opportunities.
And the irony of it all is we get paid very, very well, much more than we would in the city, for having a better life than we would.
Choose country. Discover the rural practice pathway to a health career in WA.